Welcome back to County Connections for March of 2017, our second segment. We're going to call this segment the Dan Gibbs Show. So we're going to talk
with
about
assistance.
We're going to talk about healthcare. We're going to talk about a trip you recently took to DC with National Associations of Counties. So fire away.
I'll kick off with healthcare first. Just a few days ago, the American Health Care Act was introduced in Washington, D.C. We've been really following this very closely in Summit County because, as many of you know, we have some of the highest insurance rates, not only in Colorado, but in the United States. And what happens in Washington, D.C. definitely impacts us here locally. So this federal bill was just introduced that more or less has some of the same components as the Affordable Care Act. Two major ones, I would say, that people support across the board, whether you're Republican or Democrat, Independent, Green Party, whatever, is folks can stay on their parents' insurance till age 26, as well as there can be no discrimination against folks with pre-existing conditions. So those have been widely supported across the board. A little bit of change from what we've seen before is, instead of income-based needs where the federal government will help pitch in with subsidies, it'll be more based on age. And then Medicaid has been, the expansion has been very important for the state of Colorado. Colorado is one of the expansion states. And so here in Summit County, we have close to 2,000 people that have benefited from the Medicaid expansion, and we have about 325 our kids are that. So what happens in DC definitely has a huge trickle effect on what happens right here on the ground for people in Summit County. So we're following this very closely. We're in touch with Senator Gardner's office, Representative Polis's office. Senator Michael Bennett was actually just up here over the weekend. I chatted with him a little bit about this. So I'm hopeful that our elected members in Congress will really take a close look at this particular federal bill and look at the impacts of what that means to kind of small rural communities like us, as well as, of course, urban areas too. But the big picture, I think, is the Medicaid expansion, how beneficial it's been to our community.
It was interesting that Senator Gardner signed on to a letter right after the announcement of the bill that with concerns with regards to the Medicaid expansion components within the bill. So that was interesting to see.
I really appreciate his leadership of that.
That was really good.
And that's great. We'll see what happens if that bill gets to the Senate side. There are a variety of different state bills that will be introduced soon. Really kind of the next step in terms of after we had the state bill that passed last year that directed the Division of Insurance to look at a single geographical rating area. We know that if that passed, it would mean a 23.2% decrease for folks in Summit County, which means if you're on a bronze plan, if you're single, that'd be $129.18 cheaper per month than what you have right now. And if you're a family of four, that's $435.46. Now, if you live in Boulder, it'd mean a 5.5% increase. So if you're a single person, it's about a $15 increase. So there's very likely going to be a bill that will create a single geographical rating area. So we'll see what happens with that. There will be bills on financial relief for folks that earn between 400% and 500% of the federal poverty rate. And then there will be also, bills that look at transparency measures for pharmaceuticals, a bill that directs hospitals to show their financial statements to the Colorado Department of
Insurance.
CDPH, Colorado Department of
Public
HICPUF.
Healthcare policy and
finance. Right now they send their financials to CMS in Washington, D.C. Another bill that opens up transparency in terms of health insurance companies. So we'll see what happens, and very hopeful that some of these bills will really gain in momentum, and if they don't pass, we'll definitely show up in force, I'd say, in Summit County to let people know that these bills are needed and the status quo just doesn't work for people.
Yeah, and certainly the coalition that came together last year that you helped to sort of spearhead, that group continues to be very interested in what's going on. I know I see email exchanges back and forth with you providing updates to that group, and so it's great we've got that connection of a pretty wide distribution of folks that are interested in the issue.
Yeah, definitely. I mean, there's so many people that are this close to bankrupting themselves or their families based on a small medical procedure. And when we look at the cost of living, the cost of childcare if they have kids, the cost of just being up in the mountains, it's enormous. And then you add on top of that the cost of healthcare. If you're part of the individual market, especially, you're just getting hammered.
Right.
Yep. All right. Good. Any comments from you guys about healthcare?
Well, just thinking about our community care clinic and the impact of Medicaid there could be significant. So it's like what Dan said, what happens in DC absolutely impacts our communities, and we're keeping close tabs on it.
Sure. All right, Dan, you want to talk about your trip to Washington, D.C.?
Yeah, last week went out to D.C. as part of the National Association of Counties. And Karn and Thomas have participated in those trips in the past, but I serve on the Transportation Committee. And so NACO is more or less the national equivalency of Colorado Counties Incorporated. So it's more or less a national trade group made up of county administrators, county commissioners. Some states they call our positions county administrator. Some states are even like judges in the South. They're county judges that have county commissioner type roles. And so it's a great way to kind of learn what other communities are doing. There are various different breakout groups, everything from dealing with technology to health and human services, transportation, public lands, you name it. So I always think it's beneficial, and really for me, since I used to work back there, I think how I can be beneficial to the county is keeping up with the connections I have from people that I used to work with that are in similar positions, but maybe different. But there are so many different topics that really impact us. There's a person in Washington, D.C. that's now the Undersecretary of Agriculture that has oversight of the U.S. Forest Service. And so this person used to live in Denver and worked in the Lakewood office. And here this person now is in charge of the U.S. Forest Service, and they know Summit County, and when we look at Summit County, and we consist of about 80% federal lands, well, it's great that we all know some of these people that we can pick up the phone and be like, hey, let me tell you what's going on, we need your help. And so it was a great trip. Glad to be home, of course, but very productive overall.
How many folks participated in it?
Oh, thousands, I would say. It's a huge conference.
And then there's a contingent from Colorado that goes?
Yeah, and not every county sends a county commissioner, but pretty large group. I'm trying to
30
think.
or so?
Yeah, about 30. Yeah, 30
or so commissioners, I think.
And Colorado has a large representation compared to a lot of other states.
Yeah. Good. So. All right, great. We're going to take a couple minute break, and then we'll be back, talk about water stuff and CDOT.